Hello, Namaskar, good afternoon to you. I am Sanjeev Pandya, welcoming you to Santigram Kerala Ayurveda Center's Ayurveda Mantra show on TV Asia. This weekly show is all about benefits of Ayurveda herbs and Panchkarma therapies. Santigram Kerala Ayurveda Center USA's Dr. Ambika Nair, who has over 30 years of experience in treating patients with Ayurveda herbs and Panchkarma therapies. Once again, she is with us to advise us, guide us, and I guess suggest us, educate us more on Ayurveda benefits. Dr. Nair, welcome to the show.
Hi Sanjeev, thank you very much for inviting me for the show again.
Right.
Hi my friends, hope you all are enjoying and following the tips of what I said to you.
It's always a pleasure to have you, and every week you give out very, very important tips, and I guess our viewers are also using those tips and finding it very beneficial.
Thank you.
In this episode, Doctor, we want to talk about something, we always talk about something very important, but this is a topic which I think more and more people are affected by it.
Yeah.
In the Hindi, it's called Asti Sushirata.
Yes.
In English, it's called osteoporosis.
Yes.
And viewers, many of you know what osteoporosis, and who knows, maybe some of you are suffering with osteoporosis. What exactly is osteoporosis and what causes it?
Actually, osteoporosis, it has become, like a epidemic, I can say, in USA now.
Correct.
Because actually so many, like more than 30 million people are affected with this. Especially, you asked me about what is osteoporosis. That is, we need new tissues. So the bone tissue, it doesn't make, or when the old one cannot absorb also, it happens like this, the pores will come. It is like a driftwood, you understand? Slowly it comes like this. That's why the sushirata, the pores will come on the bones. Okay, then it is, it's a bone disease actually. The density goes down, low density, but the person will never understand. That is one of the things. Okay. They will never understand that it is happening like that.
What exactly causes this osteoporosis?
I am coming to that. Okay, so cause is, first of all, it is seen in the postmenopausal time, especially in ladies. But it takes, after the menopause, minimum it takes like 7 years to settle this disease. See, when you fall and when you have a broken bone, then only normally people understand. Otherwise, the nail enamel comes down, lining on the bones, like the hair fall, brittle hair, skin will become very dry. Then only some people realize it, some people, they only put the moisturizer or oil, or they run for any new hair oils or anything like that. Actually, it is because the hormonal imbalance is more important in this. And even with, I have seen that people with the thyroid also, because they catch this disease very, very fast. Because their calcium absorption is very less in the body. Yeah.
Okay, so that's what it causes it. Now, is there any age limit that younger people don't get it, but mid-age individuals?
It is mid-age.
It is mid-age. It's mid-age and beyond.
Mid-age and beyond. Actually, some days, you get it by after 40, but early menopausal or something. At that you are very healthy, you don't need anything. Okay, it is related with the calcium and the phosphorus. These two minerals only, if it is not absorbed in the body properly, only it happens always like that. Yeah, and then afterwards, some they keep them healthy. Then like after 50, some people get after 60 years. Yeah.
Really?
So yeah.
Is it more common in men or more common in women?
It is more common in women.
Women.
But men also get it.
Achha.
Yeah, because of the hormonal imbalance.
Okay.
And little absorption of the less calcium and all.
Right.
Yeah.
Right. Have you seen that more and more of our South Asian community people, getting osteoporosis?
Not only South Asian community. I should say that because this osteoporosis is very common in the American community also, because see, when I sit in my clinic itself, we get a lot of clients, like that. But they will be, first of all, they will be going always for the all allopathic system, all their injections and everything. When the doctor will tell that now you cannot take any more painkiller or injection only, then they think of coming to Ayurveda. Okay, so like even all arthritis and everything, it comes.
And those allopathy that you say, and then I'm sure that you must have met so many patients.
Yeah.
Is it like ongoing process? They have to take that for lifetime, or just for some period of time, couple of years, and then they can stop it?
No, they can always reverse it. Like how you do is that, because like like in Ayurveda we have, in allopathy they will be using it for a long time, like management, because as you age also you need to manage yourself, right? But like with the help of medications and with other therapies and everything, they will manage even with their diet and a little more calcium, vitamin D, because vitamin D is more important in this. Vitamin D has to be taken to absorb the calcium also. Yeah, that is there. Yeah.
So once person is diagnosed with osteoporosis, what you suggest is that treatment should begin immediately.
Immediately.
Okay.
Yeah, immediately.
Otherwise it could become.
Yeah, their diet also has to, modification of diet is more important actually.
Correct.
Yeah.
All right, so we're talking about osteoporosis in this week's Ayurveda Mantra show. We're going to take a short break, and when we come back, we're going to give you more information on osteoporosis and how Santigram Kerala Ayurveda Wellness Center in USA been taking care of patients with osteoporosis. That's all coming up after the break. After the break, Ayurveda Mantra show में आपका स्वागत है. In case if you have just tuned in, this is the weekly show Ayurveda Mantra by Santigram Kerala Ayurveda Wellness Centers USA, and I am joined by Dr. Ambika Nair, and today we're talking about osteoporosis. Osteoporosis, which is a bone disease, right, that occurs when the body loses too much of bone, and then slowly density of bone also reduces, and that's what we are talking about. We talked about what's osteoporosis and what causes osteoporosis, doctor. Now let's just see if you can give our viewers an insight of it, that how it can be treated at Santigram Kerala Ayurveda Wellness Center.
First of all, we had to talk about the prevention.
Ji.
You understand? See, when you reach about like 40 years, you should go for a DEXA scan.
Okay.
That is the because without scanning, people will not understand. If they come, if we tell also, they will not even understand it. Okay. So your bone density. So that the scanning itself, they will understand whether they have the full bone density, it is okay or not. Where it is not there, then we can manage them very nicely, especially 40. And then after 50, because you have a specification of time, to take care of yourself. Okay. Then if you feel any pain, some people get pain, some people, but normally nobody gets any pain, no symptom.
अच्छा.
Yeah.
तो उसमें कोई दर्द नहीं होता, मतलब
बिल्कुल नहीं होता, कोई भी दर्द नहीं होता, कोई जरूरत नहीं है. They do feel weak little bit actually. The weakness. Then they will take something or vitamins or something like that. They are ignorant actually, because see, it is a must actually. When we get into, even including me, I am telling, we have to we have to teach them, so we, in my clinic, I always make them understand, calcium rich food you should take, all those things we tell them also.
Achha.
Yeah.
Now before you go more into prevention, doc, what I want to know, question comes to my mind, is that is it because of food habit, is it because of our lifestyle, the way we live, any one of those reasons really causes osteoporosis?
Osteoporosis, stress is also one of the reasons, because you don't sleep properly.
Achha.
Yeah, that itself make a lot of difference, because see, in dinacharya, these all are important in life. If you don't do the regular exercises, and everything counts a lot. And eating food means, in the prevention, what we tell to the people is, because you need calcium rich food. See, if you are vegetarian, go with the milk and milk products.
Correct.
Okay, so very nicely, but only problem in this, especially in USA, if you take a lot of milk also, if you have your kapha dosha is there, then you have other issues, then we teach them, how to go with that, how to take with that, like some people are allergic to milk over here. They are also another issue. Some people cannot due to the breathlessness, asthma and all, like these all issues. So we tell them which way they should take it. Okay, yeah. And then if they are non-vegetarian, we tell them to go for like sardines, like omega-3. Then all the big fishes. That is also very nice with them. Yeah, which will give them a lot of cod liver oil. Like this is very nice for them. Okay, and another like leafy vegetables, calcium rich. There are so many green leafy vegetables are also there. Chinese cabbage, like our all like kale. These are all rich with the calcium.
Meat products is also full of calcium and then the protein, right? Is it true that maybe people who eat meat, maybe they don't get osteoporosis as much as people who are vegetarian?
Yeah, that is a very nice question actually. In my clinic itself, like people come a lot. Okay, so the Americans also, they come and talk to me, like because I became vegan, now I am not eating. Can I go for fish? I tell them, because actually they feel, they feel tired. Okay, so I tell them, because actually, see, once it digests means, they can always take it. There's no issue, because they should get more protein and calcium. Calcium is needed. Calcium is needed, and we tell them salmon is, like very nice for them. Salmon and even goat meat, wild meat, anything is very good for them. They can take soups like that. They take it. They take the broth. And broth is available. So many of our Indians also take like that. Yeah.
Santigram Kerala Ayurveda Wellness Center in the USA, they're known to take care of patients with not only osteoporosis but many other diseases. When a patient walks into your clinic, right, what is the first step? What do you do, and then how you figure out cure for that person?
See, first of all, as I tell every time, that I do the pulse analysis actually, Nadi Pariksha. So Nadi Pariksha means it's like a, like open book for us. So, the one who knows how to read the pulse. So internally, wherever you have all the issues, everything I'll be seeing that. And I tell them that where you went wrong, which way we can take care. So we start from the beginning with them. Okay. Then, like their diet also will be accommodated accordingly. Whether, these people should not take, much uncooked food. They should eat only cooked food for better assimilation and absorption.
Great. We're going to take a short break, and after we come back, we're going to talk about therapies, Panchakarma therapies and Ayurveda herbs, and how it can really combine together to treat osteoporosis. That's all coming up after the break. Welcome back to Santigram Kerala Ayurveda Wellness Center's Ayurveda Mantra Show. As you know, viewers, we're talking about osteoporosis in this episode, and Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center has been educating us about osteoporosis. Now, doctor, when a patient comes to your clinic, let's say a patient has tried allopathy and many other medicines. When they come to you, obviously you do Nadi Pariksha, as you mentioned earlier, right?
Yeah.
What is the step after that? And I want you to share with our viewers some patient's real example of osteoporosis and how bad it was before coming to Santigram Kerala Ayurveda Wellness Center and how it was treated.
Yes, I'm going to tell now. I have a lot of even my viewers, because how many of them know that how I take care of them? Because whatever I say, I do it. Okay. Even the oils, even the, like we have see in our Panchakarma, we have everything specific actually, according to the customer's need, because actually that's why we tell them, we diagnose them properly actually, even though in this country I cannot say that, I'm telling you. So we do treat them in the proper way. Okay. So, then, once, I can tell that you came with osteoporosis, okay. Then I told Sanjeev, you need, because your bones are becoming very weak. So we need to take care of all these things. First of all, I'll tell them, how we had to go with the like a Panchakarma treatment, some days they may be very tired to undergo the Panchakarma treatment. So preparation of Panchakarma, like that is called Purva Karma, before that, okay. So what we tell them, we start with the herbs and like detoxification. So we give them like Snehapanam, Snehanam, I should say, because they will have very brittle like movements, because they will be very prone for any fractures. So we give them like a Snehanam according to the age also. Snehanam means they will drink ghee preparations, like we increase the dose slowly and make them prepare to undergo the Panchakarma.
Oh, nice.
Okay, that's the way it has to be. Some people are ready, means like after 3 days we can start it, otherwise after 5 days.
Okay.
Yeah. So, like then with the herbs, okay, which all the herbs according to the condition of the person. So we will write the herbs. We have very nice, it all comes through the FDA and we have no issues. People always ask me another question, that's what I was smiling. Ayurveda medicines means it is all with the toxins. Okay, I told we only remove the toxins. It is not. No, you have a lot of metals. Told no, we don't have any metal in that. Of course, Lohasavam, Loha means it is iron. So Lohasavam will have, that is written already over there.
Correct.
So it is nothing like that. People always have, like a misconception a lot actually, because there are certain people who manufacture like that. But this all like GMP certified, everything is like that. Okay, then the therapies I am telling. Okay, what we will do is that Abhyangam, we do the Abhyangam. Abhyangam means whole body, like with the oleation, with the specific, this all customary therapies. So this will be done for them. Okay. Then we use, there's a potli bolte hai isko. So even the herbs I will write which has to be used.
Correct.
Okay. So this is all customized. So that's why I emphasize on that. Okay. So we make pura potli bana ke usko garam karke we do the swedanam. In that what it does, all the inflammation slowly it drains out through the lymphatic system in the natural process. Okay. So they feel, see the flexibility, understand? No? That is more important in this. Okay.
Yes.
Then we will see that accordingly, whether they have any mucus formation or there, like a kapha aggravation. Sometimes, the swellings will be there. So this all comes down. Then we have like a spiritual treatment, like a oil bath, according to the need of the customer. Then prevention is there with Uddhavardhana. Uddhavardhana is like, like a polishing of the body with a herbal, like a powder. Okay, so that is a prevention for all these arthritis also, like not only osteoporosis, even for the arthritis also. Yeah, it's very nice.
I mean, the way you explained, Dr. Nair, to all of us, to me it seems like it at Santigram Kerala Ayurveda Wellness Centers, you don't take any shortcuts. The treatment follows from step A to B to C to D to E, and then it goes on. And the other thing I think, we all should keep in mind is that at Santigram Kerala Ayurveda Wellness Center, the herbs which are used, right, the Ayurveda herbs,
everything, yeah.
I think they are the most authentic and the most effective.
Very effective.
Very effective.
Very effective.
Right.
Yeah, they come and ask again and again. Oh, can you give me that? Some days, because the shipment and all comes little late.
Correct.
It has to come through the proper channel. Yeah.
Ji.
And then we come with the diet also with the person, like which oil they should use. They should use ghee. You understand, no? So, so everybody cannot assimilate, like digest ghee.
Correct.
So we have to, after this Panchakarma, this is another question, Sanjeev, no, my cholesterol will go very high.
Acha.
They will tell.
Really?
Little ghee, because see, they always tell, oil should not be used, So we tell this is not for that.
Correct.
Arey, tumhara to grease chale gaya, like we have to, like make the tissues for them, like otherwise how the cartilage will come, like we have a lot of cases like that. So we tell them it's not like that. So with the Sevanam itself, like they feel much better. We get a lot of clients actually. Yeah. Olive oil can be used, like tilka tel, like sesame oil. It's really amazing.
Herbs that we've been talking about it, they're very effective and that works very well. And at Santigram Kerala Ayurveda Wellness Centers, they don't take shortcut. They don't sacrifice quality, and treating patient with the utmost care is their priority and is their motto. So in case if you know someone or you, God forbid, have an osteoporosis, you should contact Santigram Kerala Ayurveda Wellness Centers in USA. And here is the most important question. Ayurveda tip.
Take 1 teaspoon of ghee every day. like you can use little ginger water
My
for
cholesterol
drinking.
is going to go high.
Yeah, no, cholesterol will not go
Correct.
high.
No, I'm just kidding.
Okay, this is very nice for you, and you should eat, like a lot of green vegetables. If you are a vegetarian, go with, like, paneer, sab aap kha sakte hain. There is no problem like that because your absorption has to be taken care. पेट साफ होना चाहिए, otherwise आपको ज़्यादा प्रॉब्लम हो जाएगा because osteoporosis mostly you can see they are prone for even all the brittle bones and like a kamar dard they sab to it is very common actually. You should always take care.
Nice. Thank you for the tip, and viewers, we sincerely hope that you will find this very interesting. Any question you have regarding health Ayurveda, please send us an email, info@santigramusa.com. That's the email ID, info@santigramusa.com. Dr. Nair, thank you so much for being with us. Thank you for educating all of us.
Yeah, we don't compromise for any less quality.
Ji.
Okay, and anybody who wants to take care, you are welcome to Shantigram Kerala Ayurveda.
And keep watching this show every week to know more about Ayurveda and benefits of Ayurveda and how it can be cured at Santigram Kerala Ayurveda Wellness Center, USA, near you. With that note, I am Sanjeev, wishing you happy weekend. Remember to stay healthy and be happy. And thank you so much for watching the show.